So, my case study I chose was case study number 14, where the primary disease concern is hypertension. Basic info about the patient in particular. He's a 54-year-old white male who has stage 1 hypertension. His blood pressure reading, resting blood pressure, was 134 over 88 milligrams of mercury. He's also overweight with a BMI of 28.9. He has an L4, L5 lateral disc herniation that can cause flare-ups that typically resolve in a couple days. He is currently fairly active. He does resistance training walking circuit, where for about an hour 15 minutes 3 times a week, which totals 225 minutes. The resistance training is with bands, and he also walks, and his heart rate holds between 125 to 145 beats per minute during that activity. He also is a former collegiate basketball player and also did high-level triathlons until he was 30. So he has a pretty active background. But can I get into the questions now? Primary disease concerns hypertension, obviously. Being overweight is the main comorbidity. His diagnosis, stage 1 hypertension, could be various factors: being overweight, endothelial resistance, could be high sodium intake, other things like that. Major signs and symptoms reflective of the disease of concern. There's no observable symptoms. Hypertension is usually pretty asymptomatic. That's why it's referred to as the silent killer, I believe I've heard. Recommendations for medical clearance to exercise or become physically active. Medical clearance is recommended. Exercise testing isn't required, but it's also definitely can be beneficial. There are no relative or absolute contraindications for exercise testing. He's not on any prescription medications currently, but he does take 81 milligrams of aspirin 3 times per week. It acts as an anticoagulant and is also an anti-inflammatory. Has possible side effects of nausea, diarrhea, can cause problems for stomach ulcers, but other than that, no prescription medications to worry about. Kind of going over his lab data. His resting heart rate is 60 beats per minute. His resting blood pressure is 134 over 88, like mentioned earlier, which places him under stage 1 hypertension. His total cholesterol is 204 milligrams per deciliter. His HDL is 52. His LDL is 135. His triglycerides are 72. His fasting glucose is 110 milligrams per deciliter, which would place him at an increased risk for type 2 diabetes. But his A1Cs are 5.2%, which is generally more reliable over long term. Over the last couple of weeks, placed in the normal category, so that isn't much of an issue. His body fat was estimated to be 29% based on skin fold measurements, and his exercise testing results were from the Bruce treadmill protocol. He had achieved a MET level of 13, which is pretty good, and a peak heart rate of 168 beats per minute. So now to the next set of questions. Any results from the medical exam or blood chemistry or other diagnostic test results that may influence recommendations for exercise or physical activity? Physical activity is recommended. Increased cardiovascular activities, definitely the most important thing. Since his blood pressure is high in stage 1 hypertension, he's also overweight and has a high body fat percentage. So losing weight from increased cardiovascular activity would definitely be beneficial for him. Based on the testing results, there are any considerations regarding the safety of exercise training? I say the main thing to worry about is his L4, L5 disc herniation, and try to be mindful of activities that will reduce the risk of flare-ups and irritation of that. So now getting into the next set of questions. Based on the information, what might you consider to determine whether this patient should perform exercise training and what benefits would be expected? So yes, he should perform exercise training. Benefits we expect to see are decreased blood pressure, improved lipid panel, decreased body weight and body fat percentage, improved strength and improved VO2 max, and probably lower resting heart rate as well with that. Any signs, symptoms of medications or other things to consider? No, not really. Next thing, now I'll go kind of get into the 12-week prescription. Just pulling it up so I can kind of look at something to go off of. So first, I'll get into his resistance training. You don't necessarily need to have him do resistance training because obviously I don't know the patient why he's choosing resistance band training the way he does or how his schedule works. But in this case, I'd recommend going into some specific resistance training done. It's easier to monitor progression. It's easier to stimulate hypertrophy and strength and improve on that, and it'll be better for increasing bone density. Not that the resistance bands won't do that, but odds are he's very used to that since he's been doing that for a while, and that's kind of, at this point, more cardio than anything else. Not that he's not pushing it, but I do think there could be some good benefits from jumping into specific strength training twice a week from that. So exercises I have picked out for him to help him especially avoid flaring up that lower back is leg press, low row on the cable machine, the hip thrust, a chest press, a seated leg curl, a lat pull down, and then a Roman chair leg raise to help get the abs. And all those are starting with 2 sets, kind of 8 to 12 rep range with about 2 minutes of rest between sets. With that thing, especially with the hip thrust, like the leg press machine and the seated leg curl, especially being important to help him make sure he's not overly extending, overly flexing his back, because those are going to be a bit higher risk for causing his back flare-ups. But helping him make sure, like, leave like probably 2 or 3 reps in the tank and make sure you're pushing it fairly hard. And the rule I kind of have to follow, I think simple enough for most people to follow, is once you're able to beat 12 reps on an exercise, go up in weight until you're within the 8 to 12 rep range again, and then just kind of keep working up to that from there. So that's his main strength training prescription. In terms of cardio, what my plan is, what I've prescribed to him, is to keep the same cardio circuit he's been doing 3 times a week. Like, I don't want to, kind of want to basically just build off of what he's already been doing to help him have a best shot at maintaining adherence rather than just totally overhauling it and giving him something new. So I think Monday, Wednesday, Friday, kind of wrote in the description. I don't know if it's what he does or what would be best for his schedule, but in this case, we're going with that. He just kind of sticks with that same circuit. So that would be about 225 minutes of zone 2 or moderate intensity cardio per week, you'd say. And from there, what I'll have him do for the first few weeks is on Tuesday, Thursday, and Sunday. So on other days, just do about a 25-minute or 20-minute just like walk. It could be walking, it could be cycling, elliptical, swimming, Stairmaster, kind of those lower impact activities to help him. We want to have him exercising every day if possible to help that post-exercise hypotension benefit always be around. So starting with that the first few weeks, and then with also Saturday doing more of a HIIT type workout where he does 2 sets of like 4 minutes on, 4 minutes off. And this is higher intensity. It could be running, biking, swimming again. But this is the point where his heart rate's higher. He can't maintain nasal breathing like you could with a zone 2 type workout. It's not all out, but it's definitely higher intensity. And then the next 4 weeks, bumping up those Tuesday, Thursday, Sunday zone 2 type exercises to 25 minutes instead of 20. And then the high intensity activity on Saturday from 16 minutes to 24 minutes. Also with those, he's doing 4 minutes on, 4 minutes off with that. So instead of doing 2 like repeated bouts from the first 4 weeks, he'll now be doing 3 of those. And then for the last 4 weeks of my cardio prescription, I'll have the Tuesday, Thursday, Sunday zone 2s bumped up to 30 minutes and maintaining the same 24 minutes of high intensity on Saturdays. And through his whole time, he'll have the Monday, Wednesday, Friday cardio circuit he's been doing in the past with the resistance bands, so he can maintain those. And then the mobility and flexibility training, kind of what I gave him. What I would prescribe to him is, let's say, bend over and touch your toes, hamstring stretch. You can also do this one unilaterally. You're sitting down. Chest stretch where your arms up on the wall, you can kind of twist away. This is really important just because almost everyone has that hunchback posture. A trap stretch, you can hold a weight to help drop your shoulder and just twist that way. Do that on each side to help loosen up his neck. Dead hang, I think these are really important. For 1, building grip strength, and 2, helping kind of get a little decompression in the spine to help him hopefully not have to worry as much about flare-ups in the past. That can help prevent more issues. Pigeon pose, it's a pretty common yoga one, but it's really good for stretching out the glutes and those external rotators of the hip, which almost everyone has tight. And child's pose, another good like kind of lower back stretch, as well as lats, and it's just usually good and really relaxing. But other than that, I want to make sure I don't miss anything when I'm answering all these questions. So doing with this, I guess, like, what are the things that may influence his ability to adhere to it? I think the biggest thing is just the new stuff. He may be busy with time, I don't know his schedule, but maybe hard for him to want to fit in those other zone 2 activities or separate strength training sessions. Especially with strength training, if that's an issue, you can always just help him find access to higher tension bands or help him find other ways to progress the difficulty of those exercises during that to help him be able to maintain and increase strength, and so that's important, especially as he ages. You can't go wrong with more muscle and strength, and that'll help with bone density as well. But he also probably has a decent comfortability with that. Since he was formerly a basketball player, he's probably been in the weight room quite a bit. What considerations might affect decisions for exercise workload or intensity? You could probably honestly be more willing to give him higher intensity stuff since he has a pretty solid workout background from his triathlete background as well as collegiate basketball. So you can start him with high intensity right away. That's why I prescribe some of that, as well as he could probably progress faster with it. Obviously, I don't know like how he'd be handling it. Based on that, like, you could probably give him maybe even more than I did, but I think it's better to start slow with it. And then the last question is based on this medical history and test results. What areas could the patient receive further education, and what resources would you use? Diet weight control is obviously probably the biggest thing since he is overweight. And he has hypertension. The DASH diet is a good thing to prescribe to him and help him understand, as well as like helping him find lower saturated fat foods that can also help decrease the risk of getting into that hyperlipidemia, dyslipidemia area. But also just, things like that, helping him reduce his body weight, and blood pressure, obviously the biggest things we need to work on for that. But that's everything.